Hello everyone, this is Dr. Ashley Etchison from the Academy of Online Radiology Education. I work at Baylor College of Medicine in Houston, Texas. This month, we have curated some interesting literature on breast imaging. In this study, authors created a risk model to identify women more likely to be diagnosed with breast cancer before or at their next screening appointment. This study collected data from a prospective screening cohort of nearly 71,000 women from 2011 to 2017. The authors developed an image-based risk model using mammographic data from computer-aided detection, including age, differences between right and left breasts, calcifications, masses, and breast density. Lifestyle and genetic supplemental risk models were also created, utilizing factors such as menopausal status and family history. The authors determined that the image-based risk model had an area under the receiver operating curve of 0.73 for predicting a breast cancer diagnosis within 2 years of a negative screening mammogram. By applying an image-based risk model, this study reveals a high-risk population that would benefit from supplemental screening. In this study, the authors sought to investigate the diagnostic efficacy of targeted breast ultrasound as the first-line imaging modality for evaluation of a palpable breast mass in breastfeeding women, including patients over 30 years old. Data was collected retrospectively from 167 women between the years 2000 and 2017. Targeted breast ultrasound was 100% sensitive and 70% specific for detecting malignancy in this patient population. 59% of patients underwent mammography at the radiologist's discretion. The addition of mammography increased the false positive rate but did not reveal additional breast cancers. The authors concluded that targeted breast ultrasound is an efficacious imaging modality for detection of breast cancer in breastfeeding women with a palpable breast mass, including patients over 30 years old. In this study, authors sought to evaluate outcomes for patients with foci detected on breast MRI and determine malignancy-associated imaging characteristics. 179 patients with 200 eligible foci on breast MRI, which were assigned a BI-RADS of 3 or 4, were evaluated retrospectively from 2004 to 2018. Malignancy rates for BI-RADS 3 and 4 foci were 1.6 and 17.6% respectively. The majority of malignant foci were biopsy-proven invasive breast cancer. Washout kinetics and size were statistically significant in their association with malignancy. The authors concluded that foci on breast MRI, especially BI-RADS 4 abnormalities, should not be disregarded due to high malignancy rates. Associated features like size and washout kinetics can aid radiologists in establishing suspicion for malignancy. In this study, authors sought to evaluate the overall performance of prone versus upright breast biopsies using digital breast tomosynthesis. 282 patients who underwent breast biopsy between May 2018 and July 2019 were retrospectively reviewed. Data points including number of exposures taken, number of samples obtained, and biopsy complications were compared. Patients undergoing upright biopsies had significantly less exposures taken when compared to prone biopsies. Otherwise, there were no additional statistically significant differences between these two techniques, including procedure time, samples acquired, and biopsy complications. The authors concluded that prone and upright digital breast tomosynthesis-guided breast biopsies have similar clinical performance, and factors such as patient comfort and procedure room logistics should determine biopsy technique. In this study, authors sought to compare the diagnostic performance of mammography plus ultrasound versus mammography plus breast-specific gamma imaging in detecting breast cancer in patients with dense breasts. 364 women who underwent mammography in adjunctive ultrasound or breast-specific gamma imaging between April 2013 and April 2016 were retrospectively reviewed. There was no difference in sensitivity between adjunctive ultrasound and breast-specific gamma imaging. However, breast-specific gamma imaging was more specific and accurate when compared to adjunctive ultrasound. The authors concluded that breast-specific gamma imaging could be utilized as an adjunctive imaging modality to diagnose breast cancer in patients with dense breasts. In this study, Authors sought to determine characteristics and reading accuracy of radiologists in diagnosing breast cancer with BI-RADS classification. 117 Australian radiologists each read a total of 300 screening mammograms and assigned BI-RADS categories. 38% of malignant mammograms were assigned BI-RADS 3, while 32% were assigned BI-RADS 4. False negative rates for BI-RADS 1 and 2 lesions were lower in female readers, dedicated breast screen readers, and readers who completed a breast imaging fellowship. The most common features associated with BI-RADS 3 lesions were asymmetric density and discrete mass. Stellate lesion and spiculated mass were most commonly associated with BI-RADS 5 lesions. The authors concluded that certain factors, including fellowship completion, reading at a dedicated breast imaging center, and gender, influenced BI-RADS category assignment and diagnostic accuracy. In this study, authors sought to establish outcomes for patients with unprovoked venous thromboembolism who underwent subsequent mammogram to detect a potential primary breast malignancy. 139 patients referred for mammogram after unprovoked venous thromboembolism were retrospectively reviewed from January 2016 to September 2019. 10% of patients were called back for additional imaging, and there were 2 cases of confirmed malignancy, which amounted to 1.4% of cases. The authors concluded that the cancer detection rate in women with unprovoked venous thromboembolism is low on mammography. In addition, false positive mammographic findings can induce patient anxiety without beneficial diagnostic yield. In this study, the authors conducted a systematic review and meta-analysis to quantify the risk for upgrade to malignancy in patients with biopsy-proven classic lobular neoplasia, including atypical lobular hyperplasia and classic lobular carcinoma in situ. 65 studies were included in the systematic review, and 16 of these studies were included in the meta-analysis. Studies including variant lobular carcinoma in situ and image discordant lesions were excluded. Pooled risks for upgrade to any malignancy in all lobular neoplasia, atypical lobular hyperplasia, and classic lobular carcinoma in situ were 3.1%, 2.5%, and 5.8% respectively. The authors concluded that the risk for upgrade to malignancy in patients with biopsy-proven lobular neoplasia is relatively low, particularly in atypical lobular hyperplasia. These findings may allow patients to undergo imaging surveillance instead of conventional surgical excision for biopsy-proven lobular neoplasia. For more details, you can read our blog where you can find links to the original publications. Please feel free to share your thoughts and questions with us on the Breast Imaging Forum, and we'll see you next month.